Good afternoon and welcome to the CCF Thursday Educational Webinar. My name is Emma Mock and I'm a patient advocate with the Foundation. Today's webinar is on how to talk to children about a loved one's cancer diagnosis. Lorda Roca Nussbaum has earned a Master of Arts from Columbia University in Developmental Psychology, is a certified child life specialist with over 15 years of experience working with children and families. 8 of those years being in advocacy and supporting patients and families in the pediatric healthcare setting. Lourdes is a former caregiver to her father, who was diagnosed with cholangiocarcinoma in 2010, and is currently a patient advocate for the Cholangiocarcinoma Foundation, whose goal is to support all members of the cholangiocarcinoma community. I'm going to turn it over to you, Lourdes. Please put your questions in the chat and I will read them after her presentation.
Hi, everyone. I'm going to go ahead and share my screen. As Emma mentioned, I know that some of you probably have seen me now as a patient advocate, so I am happy to be here to help provide some information on this topic. Okay. I am still currently a certified child life specialist. So that basically means that I worked with patients and families in the healthcare setting previously. And this was something that I used to do with patients and families in the pediatric world. And I want to share just some information because I know this is a tough topic sometimes to have with children. Oops, that was my name, but you all know who I am now. So this is my overview of what I will be talking about, types of grief, what do children grieve, conversation starters, taking care of you, and resources for family. You might be wondering why I'm talking about grief, and I will go into that a little bit more. So grief, if you were to look that up, is described as a deep and poignant distress caused by or as if by bereavement. It's not necessarily something that is a one-size-fits-all. There are different types of grief that have been described in different studies. Something that is coined as quote-unquote normal grief, anticipatory grief, complicated grief, cumulative grief, secondary loss, disenfranchised and ambiguous grief. I'm not going to go through all of those. That would be a whole other topic of discussion. But I am just going to mention these 3 different areas. What we would call normal grief is marked by movement towards acceptance. So it's kind of going through that curve of like feeling those feelings, deep feelings about situation changes, but then being able to return back to a baseline. Anticipatory grief is more of a reaction. Normally it's described as a reaction to death. And in this case, it could also be just anticipatory in terms of like a very severe illness, such as cholangiocarcinoma. I am not going to go into how that looks in terms of deep information. That, again, can be a whole other topic. And then there's secondary loss that I want to touch upon, which is when the loss impacts many areas of one's life, creating multiple losses stemming from a primary loss. And I mention these because children grieve in different ways, and it shows up just with the diagnosis of an illness. So this is just something for you to keep in mind because this is going to look differently for children depending on their age. So what do children grieve? These are just some of the things that they might grieve once they learn about the diagnosis of you or your other loved one. Loss of time together, just because you are now spending more time at maybe medical appointments, doing treatment, going to different places, impacting what the illness has done to or the impact of the illness and how it's impacted your day-to-day activities. So you might have been doing different things with your kids. And when I say your kids, it might be grandkids, it might be if you're an aunt or uncle on the webinar today, you might be referring, to your nieces or nephews. So it's just the day-to-day activities that have been impacted in the child's life. So it might be your routine to go to school or work or the morning. It could also be if you have normally planned different things during like summer vacations and now you can't do those things because the treatment has impacted your ability to do certain things, your energy level. Those are different things that children are grieving. They might not show it in a very specific way, but that's just an example. The presence, if you're away for treatment, is something else that a child might grieve. So conversations about your diagnosis. And again, there's no cookie cutter conversation. You know your child best, and this is something that I would reiterate to any parent. You know if they have tendencies to feel very deeply, are very empathetic, and these tough conversations might be a little bit more challenging because of how deeply they might feel. So the conversation that you have might look a little differently. You might need different sources of support. And of course, developmentally, it may vary based on their age. If they are a younger toddler, they're not going to understand things the way that a teenager would. So keeping that in mind as well. So these are just a few things to keep in mind when you do speak to your child about your diagnosis. Using honest language. So being honest, you don't have to explain everything in detail in terms of what the diagnosis means or the different statistics with regards to it or research behind it. Just being honest about what is going on, being open about your feelings. Children can sense how you are feeling if you are stressed or if you are not necessarily, expressing yourself in a way and it comes out a little bit more harshly perhaps. So that's something that they will notice. Clarifying your illness versus describing it as being quote unquote sick. This is important because children might understand being sick as like a cold or a flu. Nowadays with COVID, that's another sickness that people might describe. So the illness itself is not something that you want them to feel or believe that they might be able to catch or get themselves. So it's very important to just clarify what that means, and you can describe it in a different way. And of course, it's okay to not have all the answers and to say that your children know if you're maybe not telling the full truth and they might be suspicious of something that you might be saying. They might also imagine something worse than what it is, and they will go to like another level and then stress themselves out. So it's okay to say, I don't know. That's not something that you should ever be ashamed of saying. The conversation's also going to change as you go through treatment. You're going to have different, energy levels, physical appearance might change depending on what your treatment entails. And talking to your children about the treatment and what you're feeling during that time is also important. You don't necessarily want to preemptively talk to them about, if you're going to have certain side effects, but just knowing that, you might not feel as great. It might look like you're very tired. Those are different things that you just want to let your children know and at least let them know when it's happening so that they are not surprised or expecting something different from you in terms of what you can provide in that energy level department. If you're needing any types of medical devices, which many of the patients do, such as like a port or another external central line, a drain, etc., it's important to provide some preparation for what your child will see on you and on your body, because that might be a little bit startling. So if you know that you're going to go in for a port and they might happen to see it, whether you're, changing into a different shirt and they might see it on your chest. So that's something that they might question. And even practicing knowing, what to say and how you want to describe it is okay. You can definitely describe it ahead of time. And there are resources that can help with that. So that you can see something similar to a port using an actual image of a port so that they know what that is important too. If you think that your child is able to grasp that information. The same as with the drain, and talking about it in terms that they understand. So if it's a school ager who is learning about science and the body and like describing how this medicine is going to be provided to you and go straight into your system through this particular plastic tube, particular line. The drain to help things come out of your body that's not necessarily needed, and we want it to come out and not stay in. So making it in a way that they understand. If they're more in-depth teenagers, they might do their own Google searches. So trying to allow for them to ask those questions and not go down that, Google search rabbit hole where you can find a lot of information that's not necessarily accurate to what you are going to have or what it will actually look like. So some reactions may come out in different ways, again, depending on their age, depending on how they cope in general. You might see this as acting out. You might see this as a sleep disturbance. So they might, have some insomnia, wake up, have nightmares. Those are things that could potentially happen. Having physical symptoms of like not feeling well, stomach aches, headaches, things like that. They might be more emotional, whatever that might qualify under, whether it's being very tearful, angry, just more quiet and reserved. There's some children who are more internalizers, so they'll just kind of take things in and think about them and then process it that way before they actually express anything. So they might be more quiet in that sense, and that might look differently at school as well. They might not be talking to their friends like they used to or things like that. And then there's also the possibility of having regression. So having behaviors that they didn't have in this moment in time, and now they're going back towards that. You see that, and you might hear about that a lot with toddlers in terms of, they were once potty trained and now they're no longer potty trained. So that's definitely like a easier identifier as regressive behavior. Wanting to have you sleep with them in the bed when they were okay, before. So those are just some ideas of what that might look like in terms of when you're talking about things. And during this time, because it is very tenuous for everyone and it's stressful. And so they'll also pick up on the stress that you have. So just to keep that in mind. I want to mention taking care of yourself. And this is really important because having this conversation is not easy. Talking about it over time is not easy. And you want to make sure that you're surrounded by resources that are helpful for you, because this conversation might come up over and over again, depending on what it is that they're wanting to know. So some things to just remember is to identify the people in your life that you can talk to and vent to about your children's behaviors, how they're taking the news, what are the different things that are going on. A lot of times we describe these individuals as your family, and your family can mean anything. It can be your immediate family, it could be your friends who are like family, it could be whoever you define as family. Having your immediate community resources, so school, work, colleagues, church members, a therapist or counselor, share whatever you feel you can with them. With the school, it's important. This might be helpful for them to know, just because your child might be expressing some things that are not what they were doing before at school. And so then this way the teacher or school counselor might be aware of it and can also provide that support to them. And then your greater community, which is outside resources, such as our Cholangiocarcinoma Foundation community, online support groups, the Cholangio Connect program, having those mentors who maybe are going or have gone through the same situation as with having children during the diagnosis. And then your hospital support staff, so social workers or child life specialists. I know that child life specialists, I'm going to just plug this because there are some child life specialists who work in the adult setting and provide that support. So you never know if they're there. So please just ask if there's a child life specialist there. They're skilled to help with those tough conversations and help provide the language that you might need, or even just be a presence in the room if you want to help to have that while you're having that tough conversation. You can also identify a safe person that your child can talk to. So that might be like an aunt, an uncle, a cousin, somebody who's older that they feel really comfortable talking to, because some kids don't want to burden you with their feelings, and they don't want you to feel sad or upset if they're going to ask certain questions that might be a little bit more of the requiring challenging answers. And they might be a little bit more forward thinking and think of like terrible things. So they might want to ask somebody else about that rather than you. And then these are some resources that might be helpful if you feel like this is something you want to look into a little bit more. These are some websites that talk about what the different types of grief are, resources for families and things to look at in terms of development for children. And then there's always children's books that you can use. I love using children's books to help with explanations. There's plenty of them out there in terms of helping to talk about how children like have different feelings and expressing those feelings. And if anyone is interested in some of those titles that I have used in the past, I am more than happy to share those book titles with you, because I feel like the more you know, the easier it is to do different things, especially when working with kids and talking to them about this topic. Okay, and if you have any questions or you want to ask specific things to me, please feel free to email us at the website here, or the email at advocacy@curecca.org. We're using the shorter term, like end term now, so it's a little easier for you to send us a message. And that's it. Does anyone have questions?
We have one question. How detailed should you be with a 7-year-old?
I think that it just depends, and I'm going to say this a lot. It depends on what your child knows and understands. So is it a recent 7-year-old? Is it she closer to 8? What are they learning at school? What is it that you feel comfortable sharing? And you can always start with like basic information and see how they take it, because if your 7-year-old is like starting to get really emotional, you might want to pull back a little bit and just kind of gauge where they are. And I would always say to start off with the least amount of information before you add additional information to it.
Okay, thanks, Lourdes. We're so lucky to have you. Oh, another question came in. Similar question, but for a 4-year-old who has now lost their grandfather, which they had known for 3 years.
So I think in this particular case, you might want to consider talking to them about what death means. And that varies because it also depends on your personal views about what happens after death. So what language do you use? For that particular one, I would make sure not to ever say that they're sleeping. They fell asleep. Don't use that, please. That's something that children will then take, especially at this age, at 4 years old, and become really worried about falling asleep themselves with that fear that they're not going to come back just like their loved one didn't. So having that talk about, what that actually means. And if you believe that there's a place that they go to afterwards, you can talk about that. It's a little bit vague though for them because it's not really, they're more literal at this age, at the age of 4. So just to keep that in mind. And then I would probably also talk a little bit more about emotions and feelings surrounding that. Connections. There's actually a really great book that I've used a lot and I own for myself. It's called The Invisible String. And that story is about these children and this mother who's talking about how everyone's connected with an invisible string, no matter where they are, no matter if they're upset with each other or not. And it does mention in that particular storybook, I think a grandfather who had died and that they're still connected to their grandparent through that invisible string. So it's a way to just talk about connection and that no matter where you are, you can still have these memories of your loved one. And you can build upon that as well.
Okay, the next question is, what about kids who didn't know because they were too small, but we now have to share with them at a later date that we are tracking possible recurrence?
Okay. So I would say that this is something that you can potentially start talking about as a new thing because it's new to them. So even, I don't know what the age range is at this particular time, but even saying that this is something that you had before, and this is an illness that you have, and using the word cancer is okay if you feel comfortable saying that. Um, as long as you can like also mention, because I know a lot of children just take on a lot of different meanings of the word cancer and they've heard it outside of your own space, so that they might, just immediately go to the most negative thing. So talking about it in that, you've had this, um, and that this is something that you took medication for or whatever your treatment was, which helped you to not have it anymore. And that it was gone for, an X amount of time. Sometimes your body is not working the way it's supposed to, and you still, need to then take different kind of medication or the same type of medication, but this is something that you still are trying to fight. So just talking about it in that way. And since you can also mention, like, you had this time where you didn't have it, to build upon that positive, because we want to make sure that it's positive for both of you. You both, if you're going to go through a recurrence, we know that it's terrible and we don't want you to have to deal with that. But you were able to get to this point of, not having, whether you're not having any evidence of disease, or if it was, less of a disease in, showing up in all the scans, just trying to keep it as basic as possible in that sense, but also to like let them know you've gone through this, you're fighting it again, and that they can ask whatever questions that they have, and allowing them to have that space to also ask the questions and see what questions they do have. And again, if you don't know how to answer it, you can let them know, I don't know. You can tell them you're going to talk to your doctors. You can tell them you're going to talk to, I don't know, you can use me. Say you're going to talk to me a little bit more about how to, figure out the right way to like, answer that question, and we can have a conversation, and I'm more than happy to help with that as well.
Any advice on talking to adult children with their own families?
I'm wondering if you're referring to maybe grandkids. I'm going to guess perhaps, in terms of the grandparent having the disease is what I'm assuming. Please correct me if I'm wrong. Sitting down with your adult child to let them know like how much you want them to know, how close are you to your grandkids, how often do they see you, what do you do with your grandkids. I think it's important because if you're very active with your grandchildren, you might want to also have, sit down, even if it's them telling them first, or if it's you wanting to be a part of that conversation, because your grandkids are going to notice that you're not feeling as active as you once were, or if you are having different side effects that are noticeable, physically noticeable. So having that, telling them it's okay to have this conversation, but then also recognizing that your adult children know what your grandchildren can handle, because it is something that they might have noticed in the past, whether or not they've had like other people in their lives who've been like seriously ill, or if they've had a reaction to something that happens that is bigger and more like, I don't know, emotional for the child. They might want to like tone down the conversation a little bit. So just being open with your adult children about the importance, first of all, of having the conversation with the grandchildren, and then also to like recognize, you know them best as well and what they can handle.
Suggestions on helping kids not try to take on any anxiety or worry about what is going on with their father. They don't want to sleep alone anymore and have a hard time falling asleep alone now, turning their brains off, worried about dad and the future that they cannot control.
Yeah, that's a big one. Kids are going to take a lot of different things differently. If there's a way for you to practice any like mindful techniques with your children, I think that that might be helpful, whether that means like doing like relaxation before bed, having like a moment to have all of you talk about positive things for the day, and have like a new routine where you're trying to find things that are, you know, things to look forward to. So whether it's for tomorrow, we're going to just focus on like smaller steps, or if you have like a trip planned, I know some patients have trip plans to different places, which is wonderful, or something that they can kind of look forward to. I would honestly recommend talking to a counselor, because anxiety and worry can grow in children, and sometimes they might need someone who can help with that aspect. Again, I don't know how old your kids are, but I think that that would be another resource for you, and would suggest, you know, having a conversation with somebody who might be helpful for them. If they're younger, sometimes playing things out is a way for kids to kind of express their worries. So even if you sit with them and have them play out different things and allow them to use that. And if you're looking for a particular counselor or therapist, a play therapist might be helpful for younger children, because they are skilled at trying to evaluate what the play means and allowing them to use play as a way to express themselves.
So this person's referring to their adult children that don't live close and they aren't seeing things evolve. So I think they're looking for like recommendations on just how to talk to them about it.
To adult children?
Yeah.
That's a great question. I was once an adult child, as mentioned before. I think that having the conversation in a way, or even having them, if they are able to come and visit you, having, you know, maybe having them sit in on a conversation with your physician, your oncologist, whoever it is, so that they can hear the updates, whether it's after a scan, or just like a general update after like your therapy session, your like treatment, your chemotherapy session, if you're going through chemo. So things like that. I know that's a little bit tough, because adults, you know, are coping. They might be just coping in their own way by trying to close things off and not really want to see what's going on. If you want to email me, we can talk more.
Okay. Do you recommend writing letters or leaving videos for your children for the future?
I definitely recommend any legacy building. You can decide how you want to do that. If you wanted to, honestly, I think the things that are most meaningful are just those interactions that you might have with your child, the memories that you can create in the present moment in time, because those are things that people remember. You can leave letters if you want. I know that that is something that you may have seen like in a movie, perhaps, about leaving a letter, recording yourself, and you can definitely do that. I don't see anything wrong with that at all. You can create art together. You can do a lot of photos, and even do like actually print the photos. I feel like we don't do that so much anymore. We're printing them out and putting them in an album, so it's like a tangible item that they will have. Definitely, you can do that.
There's a lot of questions on the children's books that you suggest. Maybe we can put them in the YouTube description. as a
Oh,
reference, just a list of books that you recommend, or on the
yeah,
CCF Facebook site would be helpful.
absolutely. I
A
could do
lot of
that.
people are looking for books. And that's all the questions.
Fabulous. I know this one was a shorter webinar.
That's okay. If you have any questions, please don't hesitate to reach out to us. We want to help and we're here for you. So that's it.
Thank you.
Bye, everyone.